This is a stifle arthroscopy on a 15-year-old quarter-horse gelding rope horse with acute onset right stifle lameness that partially blocked with stifle block. This is the medial femoral tibial joint. The frayed tissues in the mid portion of the frame were torn meniscus. This illustrates a very degenerative medial meniscus. And I'm just probing the medial meniscus tear now. The bulk of the medial meniscus is underneath the probe there, the cranial horn, and then extending to the lower left off the meniscus is the cranial medial meniscotibial ligament. That's the medial femoral condyle that takes up most of the screen in the upper left-hand side. There's some very abnormal cartilage on the medial femoral condyle. This is the lateral femoral condyle and the lateral femoral tibial joint. This was a chip fracture that we found off the axial aspect of the lateral femoral condyle. That is a partial tear of the caudolateral bundle of the cranial cruciate ligament. You can see it's very stretched out. There is some fiber tearing, and the synovial sheath around it was very frayed and torn. This is a radiograph just illustrating where the lateral femoral condyle chip fracture came from. Again, this is the chip fracture that we're prying loose to remove. There it is, loose from the parent part of the bone. This is looking in the back of the medial femoral tibial joint. The white structures in the middle are extruded, torn medial meniscus, and there's a lot of proliferative, very inflamed synovial tissue in the back of this joint.